So, good morning, everyone, especially to our panelists, Ma'am Risa Gabilagon, Ma'am Carlina Eroy, Ma'am and Ma'am Dean Joy, Ma'am Grace Joy Herradanetes, especially to our ever supportive research advisor, Ma'am Mabe Kuinko. So, we are the researchers of the uh, research entitled A Quest Against COVID-19 Among Hospital and Clinical Pharmacists. I'm Majada Talambongan together with Christine Joy and Marian Janica Munar. So, for next, so next team.
Wait lang, ma'am, kinagalag.
So before we proceed to our purpose of our study, so it has been already a year after the lockdown, and our healthcare professionals are still fighting to eradicate the coronavirus. So for our purpose of the study, so this is the purpose of this qualitative study was to explore the lived experiences of hospital pharmacists and clinical pharmacists who work at tertiary hospitals of General Santos City in battling the COVID-19 disease. So for our findings, so during the in-depth interview, the participants depicted their lived experiences in combating COVID-19. They also discussed the possible outcomes if there were no hospital and clinical pharmacists present at the current pandemic. So, based on our findings, this is the summary of their demographic profile. So, on their demographic profile, so there are 2 males and 11 females, and their age ranges from 24 years old to 51 years old. So the oldest interviewee, yes, is 51 years old. And based on their length of service, the shortest has a 3 months working experience, and the longest has a 28 years of experience as a hospital pharmacist. So next. So after interviewing, we were able to get 10 themes, which are dispensing medication dispensing, antimicrobial stewardship program, pharmaceutical quality assurance, drug inventory system, regulatory compliance, impact of the pandemic, professional communication, and healthcare team collaboration, medication therapeutic management, clinical strategies and interventions, and lastly, the recognition of pharmacy profession. So these are the themes based on the reports of the participants. First is the medication dispensing. So this theme discusses the roles of hospital pharmacists in medication dispensing. Particularly, it pertains to the delivering of medication to the isolation area, checking and ensuring the availability of medicines for a continuous medication therapy. Although it is included on the dispensing role, participants stressed that they were not able to compound any COVID medications because the medications that is needed by the COVID patient is readily available by the dosage form that they need. So next.
So next is the antimicrobial stewardship program. So to promote appropriate use of antibiotic and to avoid antibiotic or microbial resistance, AMS program was established. Clinical pharmacists usually check the charts to minimize possible errors regarding antimicrobial medication. The relation of this to our study is that antimicrobial stewardship programs is one of the major roles of clinical pharmacists during this pandemic. This program will help pharmacists to monitor other possible complications associated with antibiotic resistance, especially to COVID-19 patients.
So next is the pharmaceutical quality assurance. So this theme particularly discusses the role of pharmacists in quality assurance. To ensure the quality, pharmacists only accepts FDA approved and PTC approved or the Pharmacy Therapeutic Committee approved medication to provide proper storage of medication, reviewing and assessing all medication orders, and clinical pharmacists specially observes the timely provision and administration of both inpatients and outpatients during this pandemic.
So next is the drug inventory management. To make sure that medication is available for patients, especially for COVID-19 patients, the Pharmacy and Therapeutics Committee, together with the Purchasing Department, procures medicine ahead of time in case of fast-moving medicine are out of stocks. And if medications are not really available and shipments are delayed due to lockdowns, pharmacists are forced to do emergency purchasing in other pharmacies outside the hospital or in other hospitals if necessary, just to provide the accurate medication for the patients. And next is the regulatory compliance. Regulatory compliance has to do with a set of guidelines that an organization is required to follow in accordance with the law to make sure that what they are giving to the patients are safe and pass legal processes. Pharmacist needs to comply requirements for the specific regulated drugs. For example, the Philippine Drug Enforcement Agency or the PDEA requires pharmacies to submit Controlled Drug Administration Sheet or CDAS for regulated drugs. And if the medicines that the patient needs does not have certificate of product registration, the hospital pharmacist is the one who will process the approval the approval and get authorization to supply the COVID medicine to the patient.
So next. So for the next theme is the impact of the pandemic. Next, please. So for the impact of pandemic, we were able to identify uh, disadvantages and advantages of the impact of the pandemic. So for the first, disadvantages, first is the wearing of personal protective equipment. Next is overtime due to understaffing. Next is financial dilemmas. Next is limited interaction with patients and on hold health promotion activities and the risk of being infected. Next is the advantages. So under the advantages is the prioritization of immunization program, gaining trust from people, computer health information system, acquiring new experience and knowledge. So for the disadvantages, we have the wearing of PPE. So based on our respondents, wearing PPE makes them uncomfortable, especially when working. Next is overtime due to understaffing. So our participants stress that they work sometimes 12 hours shift, and then sometimes the overtime does not have any pay, and then this due to understaff, the workload of the pharmacies also has increased. Next is there were no all their health promotion activities were put to hold because they prioritize the on handling the COVID-19 patients. Next um, is the financial dilemma. So the pharmacists stress that they also face financial dilemmas inside the hospital pharmacy. Next is the limited interaction with patient. So the interaction of pharmacies with patient was also limited. They weren't able to perform counseling and were not able to receive any feedbacks from their patient. And then next is the risk of being infected. So the participants also discussed that due to this, the impact of the pandemic is while working, they are at risk of being infected of the coronavirus. Next is the advantages. So the participants discuss the advantage of being a pharmacist or a frontline worker, wherein they are prioritized in immunization programs. And then they were also encouraged to join seminars regarding immunization. Next is pharmacists feel overwhelmed and afflicted towards their job by gaining trust from people. Um, Next is using of health information systems such as BizBox. So with the use of BizBox system, the pharmacist does not need to go to the COVID ward because they can access the medication chart or the patient chart of the patient through the system, and then they can monitor and evaluate the medication therapy of the patient without having any direct contact with the patients. Next is acquiring new experience and knowledge because the participant says that some of the medications were new to them, so being familiarized with this helps them in evaluating the medications of the patients. Next.
So next is for the theme of professional communication and healthcare team collaboration. So the participants openly communicates and collaborate with other medical and healthcare professionals regarding COVID-19 medications in handling COVID-19 patients. Then the next one, then next is for the medication therapeutic management. So this theme indicates that the participants ensure the best therapeutic outcomes for patients through good therapeutic management. That is to monitor, manage, and evaluate drug therapy to prevent medication errors. So next is clinical strategies and interventions. The participants certainly provide clinical interventions to improve the health outcomes of the patients and also created some plans or strategies to extend help for their patient safety. By that, it signifies that there is flexibility in their roles.
So for the last theme is the recognition of pharmacy profession. So according to Malhi 2020, pharmacies are under-recognized by both physician and patient. So one participant said about stereotypes. So according to them, um, it is inevitable. Stereotypes are inevitable. So for them to handle these stereotypes, they educate people that pharmacies are more than dispensing; they are more to it. And and then for instance, other healthcare professionals were, um, although there are stereotypes, pharmacists also discuss. The participants also discuss about how other professionals treated them. So before the pandemic, they also stressed that the participants were already used to approach them, ask them regarding the medication therapy, if they have any questions, they approach the pharmacist immediately. So the participants also differentiated the roles of hospital pharmacists and clinical pharmacists. So clinical pharmacists are stationed at the clinical area. So they are in charge of monitoring and evaluating the medication therapy of the patient. While the hospital pharmacist is in charge of procurement, storage, and dispensing medication. They are usually stationed at the hospital pharmacy.
So for discussion, in summation, the information that was extracted from the participants based on the purpose of the study are as follows. In terms of roles of the pharmacist, the participants are involved in dispensing medications to the patients, assuring quality of pharmaceuticals, managing antimicrobial stewardship program, drug inventory, complying to regulatory requirements, managing medication therapy, and providing clinical strategies and interventions. Furthermore, in exploring the lived experiences of hospital pharmacists and clinical pharmacists, the researchers determined the following information. Pharmacist works collaboratively and professionally with other healthcare professionals. Various impacts brought by the pandemic was also determined along the way, and recognition of pharmacy profession was also discussed.
So for our recommendations, first is for the future researchers to discover more in the roles of hospital and clinical pharmacists in battling COVID-19. The researchers recommend on including patients who are survivors of COVID-19 and other healthcare providers as their participants to extract more information and significant statements. Then second, for the academy pharmacist. Based on the findings of this research, the researcher would like to recommend to the pharmacy instructors the findings of this study as a tool to prepare future hospital and clinical pharmacists, and also to train them to be flexible in working and teaching them to be professional in handling conflicts and misunderstanding. So third is for hospital and clinical pharmacists. As the patient pharmacist interaction is not possible during this pandemic, the researchers recommend the use of other modes of communication, such as written communication to counsel patients. For example, they can provide written or printed medication instructions to patients upon discharge or allow the nurses to relay the pharmacist's instruction to the patients. The researchers would also likely to recommend about installation of televisions inside the patient's room and play informative videos to provide patient education. Then fourth, for the Philippine Pharmacists Association, the PPHA should encourage and train more pharmacists to help in administering COVID-19 vaccine, since it is now allowed by the Professional Regulatory Board of Pharmacy under Section 4, Article 1 of the Philippine Pharmacy Act. In that way, vaccination of people will be faster and the spread of COVID-19 will be reduced. Wait lang, ma'am. Nag-move na ba ang slide ko, Madge? Ayan na. So for the fifth recommendation is addressed to the Department of Health. So the findings of this study should be considered by the DOH in providing awareness and recognition of the pharmacy profession in the healthcare system. Sixth is for hospital administration. The researchers observed that there were only a few who utilized health information systems such as BizBox. Then, therefore, the researchers recommend using such health information system in other tertiary hospitals to optimize patient care and drug monitoring in the most convenient way for the pharmacist. Then the last one is for the community. Pharmacy profession has been overlooked for quite some time. Community should start to appreciate or recognize pharmacists that they are also part of the healthcare team. People should be aware about the roles of pharmacists, not just during this time of crisis.
So that ends of our presentation of our findings. Thank you.
Okay, congratulations. May we ask all the proponents to please unshare your screen so that we can start with our Q&A. So this group no is under Mamabe. Okay, so I would like to congratulate now the group that despite of the different challenges during this pandemic, you were able to finish your phenomenological study. And we really appreciate your efforts, especially in getting all this vital information that can really help the pharmacy profession, especially those who are assigned in the different communities. May I ask Ms. Munar, based on the different findings, how many themes were you able to come up with this study, Ms. Munar?
We were able to come up with 10 themes po.
Can you share to us how you were able to come up with those themes? How you go through with the data that you have after your interview with your participants?
So we transcribe what we have extracted po from the participants, and through that transcription, we identified significant statements po, ma'am. And after identifying the significant statements, we were able to identify cluster themes from the significant statements, and from the clustered themes, we were able to come up with the 10 emergent themes.
Ms. De Guzman, how many participants do you have?
We have 13 po, Dean. 13
13.
participants po, opo.
When you were able to come up with that many participants, were you not able to have the saturation point at 8 or 10?
For the clinical pharmacist po, Dean, we have reached the saturation point since they said that they are working in the same institution po.
Dean, can I add on that? So, actually, Dean, at some point, we reached the saturation point, but there is a scheduled interview on a certain pharmacist, which we have interviewed already the institution, but on that day they were already stationed at they weren't stationed at the COVID wing, so we wanted to extract more information if what is the difference if they were stationed at the COVID wing already. So we interviewed again. Not again. We continued with our scheduled interview with the participant ma'am.
Okay. I will ask now some of my colleagues here, baka may mga tanong sila.
Okay na din. So in my case, okay, good morning students. Congratulations, no, magandang paper nyo. Let me just add something to improve your paper. In your significance of the study, I have noticed that you have used the word researchers. So for a beginner like you, it would be best if you use the word investigators dyan sa inyong significance of the study. And then I have also noticed dyan sa instrumentation you, how did you, anong method ang ginamit nyo for instrumentation? For the data collection, what did you use? Sa instrumentation.
We used ma'am, in-depth interview.
For that in-depth interview, was it a semi-structured or anong ginamit niyo dyan?
We formulated it, ma'am, based on the Philippine practice standard, and we also look for a practice standard for the clinical pharmacist. So we aligned it with those, with the two standards.
What I mean is that you have to, let me just add that with your research instrument, make it complete lang. It would be better if you have to identify whether you have used the semi-structured, kasi since this is a quality research, most of the quality research, we utilize the semi-structured interview, or you can have the unstructured interview. Di ba meron kayong isang grand tour question? Tama ba, Majeda?
Yes po, ma'am.
So I believe this is a semi-structured interview. Tama?
Yes, ma'am. It was validated by validator.
No, what I mean, it's a semi-structured interview. In other words, when you say semi-structured interview, you have prepared the questionnaire na, but the answer of your participants may vary depending on the, depending on their answer, no? So yung mga follow-up questions nyo may vary depending on their answers. So let's say, for example, if one of the participants says na happy siya,
Mano ka naman.
so iba na naman ang sagot mo kung happy ang answer niya. If another participant said na sad siya, iba rin naman ang magiging answer niyo. So for that research instrument, I would just like you to add na ano sinulat niyo dyan, the researcher use only one research instrument, and it was the, can you please add semi-structured? So, or you may say, data collection method included. Pwede nyo nang lagyan dyan ng semi-structured interview, semi-structured in-depth interview. In-depth interview.
Okay po, ma'am.
Okay, ano pa ba? Another thing, with the sampling technique, for the sampling technique, pwede dagdagan nyo lang yung sampling technique. Did you use the purposive sampling technique, and then you enhance your sampling technique area based on the semi-structured type na in-depth interview. And then another thing that I have noticed, Majeda, how are you going to prove to your reader that what you have collected is true? Hindi siya lalabas na chismis. If indeed your participants really said those lines, how are you going to prove to your readers na hindi siya chismis? Or what you have written in your manuscript is the same as what has been answered during the interview.
Ano, ma'am, yung transcribe po namin, ipa-evaluate po namin, ipa-confirm po namin ulit sa participants if what we have written is really what they have said, ma'am.
Okay, for a quality research, it is best that you should include a separate section in your paper, a section on trustworthiness. So you have to include there na whatever has been answered by the participant, kana bang masaligan ang inyong papel. So to enhance the paper, the manuscript, to make it good and trustworthy, you have to include another section there. So mayroon tayong mga criteria for trustworthiness in every qualitative research that you have to include there. Idagdag nyo na lang siya separate section of your chapter 3. You can have it on the last part of your manuscript para maganda na talaga itong papel. And then, for the data gathering procedure, I have also said it to my advisee doon sa ating mga data gathering procedure. For a quality research, kasali dapat doon sa data gathering procedure would be letter for parang acceptance letter or letter to participate in a research study, because I have also noticed doon sa ating appendices parang consent letter na kaagad. So meron akong nabasa dito na part sa inyo that you have said that some nag-refuse. Hindi ba lahat yon, Majeda?
Ma'am?
Lahat ba ng in-invite nyo positively responded to your invitation?
No, ma'am, because they were busy.
No, ma'am.
Okay, so it would be best, since hindi naman lahat respond positively, it would be best that you attach a sample letter of letter of parang acceptance letter or letter to participate in a research study. Para talaga buo ang papel. And I would like to congratulate you have come up with emergent themes na most of the terms there can be taken from the PhilPSP. Okay, so ito talaga yung, if you look at the theme, maganda siya kasi pagbasa mo, it goes with pharmaceutical needs, no? So I would like also to, how many themes do we have?
10 teams po, ma'am.
10 themes. So I would also like to inform lang na if you come for our emergent themes, there are no limits for the emergent theme. Even if we only have one, kahit meron lang tayong isang significant statement, if you believe that that one statement malaki ang contribution niya doon sa study ninyo, pwede natin siyang gawa ng emergent theme. So you have a good emergent themes, come up with a good, you have extracted a very good significant statement to come up with the emergent themes.
Ma'am Eroy, can we enter up, no? Can we go
Yes.
back, no, with the different items? No, I know Ma'am Eroy already had given a lot of recommendations, but can we go back from the title page so that we can give also our comments and suggestions on how they can improve the entire paper, starting with the title page, Ma'am Reza.
Yes, Dean.
Okay.
Let us start with, I'll facilitate, Dean. Is it-
Yes, yes.
Okay. Sige, let's start with the title page. Any comment first, Dean or Ma'am Eroy, with the title page?
None.
Okay. For the approval sheet, I'll be giving you the format, the correct format for the approval sheet, Majeda. I'll be giving you, just contact me again. We have a format here na ginagamit kasi. Okay, for the acknowledgement, any comment po, Dean or Ma'am Eroy? Acknowledgement? Wala.
Ako, ano lang ba? I just don't know if this is correct. If we need to write the kana ganing Mrs. Grace Joy Nietes, Mrs. Carolina P. Eroy, kanang Mrs. Risa Gabilagan. I just don't know for a
Pangalan na lang, Ma'am.
for us for tama lang di. Ano ba dapat dito din?
Pangalan na lang.
Name, ma'am, name, and then title.
Okay.
Wala nang ano, you removed the misses, ano ba? Or the miss. Pangalan na lang and then the title.
Miss yan, miss. Wala man na miss, ma'am. Kulban ko.
Sige. How about the abstract po?
For the abstract, can you please add the word semi-structured in-depth interview?
Okay. Table of contents.
For the abstract, I think they need also to include the mga salient implication of this particular study. I think they just presented some of the findings, no? but walang ni isang implication. Maybe you can add at least one salient implication of this particular study.
So, table of contents. I just remove the, what do you call that? Yung mga dot.
Table of contents.
Introduction po.
Introduction. Di na ko manggilabot ang introduction. Okay na na introduction.
So, I think even the purpose of the study, okay na ako. Significance of the study also.
For the scope and delimitation, ma'am, kindly correct na lang the date wherein it's being conducted, because August 2020, I think they're just drafting their proposal at the time, no, when we had our proposal defense December, and you started, no, with the actual conduct of the study, I think March, or you started February with all the preparation, no, until April of 2021, but not August 2020, because you just started with your research one in that particular month.
Oh, din? Perhaps, wala lagi ko yung makita ng August sa ako.
There is ako, ma'am, page 5 in the scope and delimitation.
May ako din.
Ako May.
May po yung nasend ko. ma'am.
May 5.
January until May 2021 ang nakalagay dito sa akin din.
Nakalagay dito sa akin ng August 2020 to May 2020.
Sa akin, May 5 until May 7, January until May 2021.
Baka ibang file ito na, ma'am. Sa gisend ito.
Baka ibang file lang na open mo, ma'am.
Oo,
Yun lang
dalawang
man
file
ako
na send nyo kay ma'am, Reysa, na forward sa akin.
Basin sa, okay.
Galing ito sa na-forward ni Ma'am Reysa eh. Open ko na lang yung kay Talambongan.
Okay na po din. Na-open. Okay na.
Yes, ma'am.
Okay.
Where are we? Waste
Significance of the study, ma'am.
significance.
Ay, sorry. Review of related literature. Wala po. How about the methodology? Research design.
Research design.
And research local, I think. Okay na po.
Okay na ako with the research design.
Participants.
Research local. Wait. Participants. Page. Doon sa page 23 ninyo, i-insert nyo na lang yung research instrument na complete. Research instrument for page 23.
Opo, ma'am.
Okay. So I think meron.
Okay na ako with research participants.
So next, let's have the sampling technique, our research instrument, sampling technique. Pinadagdag ka lang sa research instrument, ma'am, no?
Oo.
Data gathering.
For the data gathering, you just add what I had recommended a while ago on the letter to participate in the study before the consent.
And then data analysis and ethical consideration. Okay na po.
Ano lang, typo error with, can you please check the spelling of Colaisi? Kasi parang consistent kayo with the double L from the beginning up to the end. Ano bang correct spelling? Parang 1L, double Z? Race?
1L double Z.
1L double C. Okay. Lahat ng word ninyo ng Colaisi, paki-change lang ng spelling.
For the findings po,
Before the findings raised, ito yung section students that you have to insert the section for trustworthiness for quality research.
the ethical consideration.
Findings.
Findings.
I observe no, in the findings, you are supposed to have your discussion, especially with the integration of literatures that support the findings of your study in your discussion in chapter 4 and not in chapter 3. So in your chapter 3, just merely include all the significant statements gathered from your participants.
What do you mean here, Din? Analysis nila? Sa analysis?
Yes, ma'am. Kasi ang findings na section, findings lang talaga dapat. So I think they included some discussions, analysis sa kada emergent na themes.
Okay.
Yung mga parts na yan na analysis, Majeda, you transfer it sa discussion na part.
In qualitative research kasi, I just want to make some suggestion. Like for example, with the different significant statements, like for example here, I'll be sharing my screen na lang. Like for example, with medication dispensing, although we know that this is a term that is really being used as part of steroid, yung ginagamit talaga sa atin. But then, based on the different statements that we extracted, ano yung meaning para sa kanila in relation to this particular role that they are portraying? Like for example, ang work to hospital pharmacist kay amo jud di ba mag-prepare of meds. I-prepare mo lang yung right medication. So what they are really trying to convey here, sa tingin ano yung i-convey nila dito based on your formulated meanings? Right medication. So that is the emphasis on the correct medication, in dispensing. Hindi kami nag-compound ng sterile products for COVID-19 kasi yung COVID na paggamot natin is already to use na siya. Like for example, even in your theme number 2, antimicrobial stewardship program, you are referring to stewardship program, but then the statement says, ang ginagawa namin, dedicated talaga ang work namin. So it's more on the different traits or values of a good pharmacist, a clinical pharmacist, wherein she is really dedicated sa kanyang work. So it should be, for me, like there are certain statements that it is being reflective sa mga statements na to, like for example, dedication. So lalabas yan doon yung dedication, isa yan sa mga qualities of a pharmacist, yung dedication niya sa work niya, yung dedication. Hindi ko siya nakita sa ano ba. Ito naman ito. yung nagahatag jud sila og uniform. What will be the formulated meaning of that? When they are really isa sa mga quality na nakikita ko dyan, no, based on the statement is very meticulous sila, no? Being meticulous, which is a positive trait of being a good clinical pharmacist, no? Aside from being dedicated, being dito sila, yan naghahatag jud og yellow form. Kasi we can change the theme itself based on the different statements. Kasi ang lumalabas dito actually sa mga statement is more on the positive qualities of pharmacists, no, in yan, mga positive qualities nila. They are not referring to the stewardship program itself, no, ganon. Kasi pag sa qualitative research kasi ipapalabas natin kung ano yung na-experience talaga nila. It's not on based sa mga literatures, no, kasi parang magiging quantity na yun siya. So kaya nga dito napapansin ko like tung among kinabuhan, ginamonitor pud namo. Okay, ito yung anong klase ng quality ito ng isang pharmacist, yung naga-monitor jud siya, gina-monitor jud namo. Oo. Kanina yung nakita ko is one of the qualities, yung dedication. Another one is yan, very siya, keen siya in tapos isa ito yung monitoring. Mamabe.
Din, paano yan siya, Din?
Oo, kasi parang lalabas siya, ma'am.
Dagdag lang siyang
hindi
quality.
siya lalabas po, like sa team, hindi siya lalabas at antimicrobial stewardship program. Qualities of, baka may iba pa doon sa kanilang mga statements na lumalabas yung mga different qualities of a pharmacist na very important talaga siya, no? So, kasi nakita ko, wala akong nakita nga dito na emergent theme on.
Din, if I may ask din, no,
Yes.
as I have understood the paper din, okay, pwede lang ba siya na i-add nila ang qualities but not to omit these emergent themes because like what I have said a while ago, these qualities are competency standards of clinical pharmacists and hospital pharmacists as reflected in the practice standards for pharmacy.
Yes, ma'am. Wala namang problema kasi
Okay lang.
sa natin, no, sa interview guide. But then pag quality
Idagdag lang ang quality.
we will be extracting kasi out from that interview guide ano yung mga lumabas. No, ano yung mga lumabas. So like for example, in relation to medication dispensing, mas na ipakita nila doon na qualities of or competencies of, pero ang more on qualities ang pinalabas nila sa statements kumbaga ito yung mga qualities ng isang pharmacist, especially in stewardship. Lumalabas na dedicated sila at the same time
So din dagdagan namin ng isang theme on qualities, or we need to change really yung emergent theme na to, yung sa AMS, or dagdag pang 11 or change na lang po.
Kasi ito ma'am kasi yung mga significant statements, it's more on related, there are some questions related to, like for example, stewardship program. So pero ang lumalabas doon sa statements nila, it's more on, pinapalabas doon is dedicated sila, nagmo-monitor talaga sila. So those are the different qualities kasi hindi kasi tayo magpapalabas ng kung ano yung, di ba, sa atin meron na tayo, it's more structured kasi tayo, no? Meron na tayong, ano yan, meron kasi tayong mga, ano na, may knowledge na tayo about this stewardship program. However, based on the different significant statements, doon tayo nag-extract kung ano ba yung ano yung para sa kanila, no? Ano yung meaning ng experience nila on stewardship, no? Antimicrobial stewardship. Ano yung meaning sa kanila? So kung it appears na parang pati yung emergent teams natin structured siya masyado based doon sa ating parang hindi tayo naka-extract, no, ng doon based sa mga sinabi nila. Kasi like for example dito, dedication, no, lalabas yan. Distinct nga trabaho ng clinical pharmacist. So kasi magsa-start talaga yun how they put meaning on the on the statements that they have, no, like for example nagahatag jud mi og yellow form, so meaning very keen sila, so lalabas doon na in order for them, no, to be effective in stewardship, ito yung mga qualities na pinapakita nila, no, they are monitoring, they are really dedicated, they are very keen. Tingnan ninyo dyan, sa mga nila. Concentrate mi ani sa mga antimicrobial. Gina-monitor jud namo. Okay. So yung monitoring, lalabas yan doon. So ang mga lalabas yun doon, ma'am, part ng nila, good qualities na steward, no? As good steward, lalabas yung qualities nila na yun. Yun yung in-extract natin. Na nagmo-monitor sila ng trabaho nila, lalabas yun doon that they are dedicated, no, mga ganon.
So possible din po na kukuha din kami ng ibang significant statements. Basta talking about quality. Although halimbawa na-tap na namin, na ilagay na namin sa other themes, pwede rin pang ilagay din siya ulit for that quality. Qualities of a pharmacist na theme. Saan doon?
Yung statement, yung mga statement na yun is more on sa isa siya na cluster, ma'am, ng mga qualities, kasi para sa akin if I'm the researcher, yun yung lalabas kasi yun yung sinasabi ng mga participants. Lumabas dito na dedication is really needed, no, as a good steward, no, dyan. Part yan, nagmo-monitor ka lagi. So anong klaseng quality yan na nagmo-monitor ka lagi, no? Ganyan. So
So idagdag siya din. Idagdag lang ang mga qualities sa emergent teams.
Isa yan sa mga nakita ko, ma'am. Kasi hindi ko nakita sa inyo yung qualities. Dapat lumabas siya doon. Ano yung mga qualities? Qualities ng isang pharmacist, no? During this COVID-19, no? Na lumalabas yung kanilang mga magagandang qualities that they are really dedicated sa work nila.
Sige po. Noted din. Thank you. Kumbaga din, it's more on sa effective na side din, no? Na lumabas. Yung attitude nila, parang ganon. Hindi na napalabas.
Like for example, itong pharmaceutical quality assurance, dapat, ma'am, yung wordings natin, it shouldn't appear na whatever kung ano yung nasa literature. So, like sa quality assurance, anong magandang ninyo dito na, kasi sabi niya, ang process na mo gina-prepare sa pharmacy ang gina-request. So it's more on yung how they were able to maintain ba itong quality assurance. Hindi lang yung, dapat meron tayong mga description dito about paano nila, no, ginawa itong quality assurance.
Og adjective din.
Oo, may mga adjective ka dapat describing dyan based doon sa mga significant statements.
Okay, sige din. So, yun yung kulang sa each. Halos lahat ng
Oo.
theme dapat may
Dapat,
adjectives.
oo, ma'am. Kasi
Yung
parang,
implications
para,
toward the
para it will
theme.
really appear, ma'am, na galing talaga doon sa, na-extract natin sa mga, sa mga participants.
Sige din, nakuha ko na din.
Nakuha mo. Like for example, sa
Opo,
quality
din.
assurance, ano yung mga sinabi dito, ang process niya.
Sure, naa-assure, parang ganun kasi. Andyan din, naa-assure, ensures, yun yung pabalik-balik dyan eh. The storage, stability.
So it's more yung mga ginagawa nila to ensure na ang quality assurance is being observed. Parang ganun, ma'am. So dapat
Sige, sige.
change lang siguro yung description natin. Andyan pa rin yung quality assurance, but then you need to, to add, depende doon sa kanilang mga na-extract ninyo ng mga meanings from the significant statements.
Sige po din, review namin lahat po yung themes. Dapat may adjectives, para may description. Then we'll add on, we'll take into consideration yung number 11 na theme for the qualities of a pharmacist.
They're talking about their roles in quality assurance. Like for example, this one, ma'am, isang role namin is storage and stability. Is certain na ngayon na may vaccine. So, roles of pharmacists in quality assurance, yun pa yung halos lahat dito. So, yung role niya is ina-assure niya na safe ang mga gamot.
Yes,
Another one, ayan.
quality or genuine yung gamot.
Pwede, parang roles of pharmacist in quality assurance, ma'am.
Okay na yan.
Kasi more on roles dito sa mga significant statements. Ano yung mga ginampanan nila na role?
Sige po din, okay.
Like ensuring availability. Ito stability, safety, So, ang lalabas doon, ang mga different roles nila in quality assurance, lalabas na they are checking for the availability, for the safety, ma'am.
Noted po din.
More on roles ang nakikita ko dito. Roles of pharmacists, no? To ensure yung sa QA. Sige. I-go over na lang ninyo, ma'am, no? Like in relation to regulatory compliance.
Yung sa impact ba din, okay na ba yan? Or lagyan pa ng din na description.
Impact of pandemic financial dilemmas.
Or idiretso siya, advantages and disadvantages brought about by the pandemic.
Is wearing of PPE considered that as disadvantage?
Actually, ang na-discuss na, sige, pa-explain sa kanya din.
Why you were able to itong wearing of PPE? Kasi wearing of PPE is part of protective natin, no? Measures.
Po din sa based on the statement of the participants din, because it made them feel like they are suffocated and comfortable po. They made mention din na wearing of PPE is an disadvantage for us, ganyan.
I think naigangan sila.
May
Yes, ma'am.
din, ma'am, may instances din daw, ma'am, na nag-aakyat baba daw sila from pharmacy to COVID ward, tapos parang yung mahirapan daw sila maghinga, ma'am, pag gina-wear yun. Kahit yung simple na lang, ma'am, na face mask. Yung face mask daw, ma'am,
Suffocate.
mahirapan daw sila.
Tapos sa time daw po na when they wear po, ma'am, parang nag-ano siya ng time.
Especially yung face shield daw, ma'am. Pag gabi na daw, parang hindi na sila masyadong makakita dahil sa face shield.
Anong mas maganda, Ma'am Risa and Ma'am Eroy? Instead of disadvantages and advantages, ano mas maganda? Negative effects, positive effects. Disadvantages and advantages. Ano pang magandang wearing of PPE?
Actually, the last time din na lumabas yun is yung risk. Meron dun kasi challenges, risk. Tapos pinalitan nila ng disadvantages. Kung ano pa, kung mas applicable siya, yung risk or challenges. Parang ganon.
Pwede siya ano, ma'am. Positive impact at saka yung negative impact po.
Hirapan po ng neurons. Okay. Baka kasi may mas maganda pa ba, no? Yung describing their experience, no? Like for example,
Yes,
you may mention that they put some negative doon sa pag-wear ng PPE na supposedly wearing of PPE should be a positive action siya to protect themselves. However, para sa kanila, they are so uncomfortable wearing PPE, no? So para sa ilahang part, yun yung disadvantage. Return.
Tama din kay baka maanugod ma-misinterpret ang wearing of PPE as a disadvantage.
Oo. Perceived.
Hindi pwede ilaha lang perception din. Okay, based on their study, perception man lang nila na nagiging disadvantage ang wearing of PPE. Go Risa, English.
I think
Pros and cons, ma'am.
I think struggle is more appropriate din. I think struggles during pandemic. Kasi it's a struggle, right? Struggle for them. Kasi sa
Oo,
disadvantage.
Kasi
Oo,
disadvantage kasi
disadvantage.
parang it will appear ba na wearing of PPE is a disadvantage, wherein it is an advantage on their part dapat, no? Kasi they will be protected. Struggles.
Isahin ba nila yung advantage din? Struggles and hustles. The pandemic. I think it's right, 'di ba din sa quali na research, you can play with words.
Yeah, yes. Pwede na siyang overtime due to understaffing.
Pwede sigurong i-separate na lang din ang advantage tsaka ang disadvantage para struggles na lang doon sa disadvantage. Then positive impact na lang doon sa advantages. Ilabas na lang siya.
Pwede siguro yun na, ma'am, no? Struggles na lang instead of negative disadvantages. For now, yun na lang muna para maka-move on ta.
Struggles
then
or
maybe,
challenges?
oo, kasi you can, ano naman, no, while you are reviewing all the different themes, you can look for more, yung magandang mga terminologies na pwede natin to describe, no, those experiences.
Pwede naman din challenges kay if you look at the statement ng mga hospital pharmacists, sabi nila yung challenge doon is yun. So pwede struggles or challenges. Isa sa mga challenges, clinical pharmacist number 6.
Mm-mm.
Ilahag yun ng words ang challenges based on their statement.
Okay? So you play with those words, siguro mo na lang mamabe. Tingnan ninyo during your discussion, yung struggles and challenges. It can be challenges, no, that they experienced during the pandemic or encountered during the challenges encountered during the pandemic. So ang challenges on the financial, on hold, ano itong gina-mention niyo, unlimited patient interaction. No?
Feeling na po pwede
Ano ma'am?
challenges and victories. I guess the disadvantages has become victories sa mga pharmacies during the pandemic kasi they gained trust from the people, di ba mo na inihang gusto ipagawas
Oo.
na sila yung mga na-acquire ng mga new knowledge o sa paninigibutan.
Challenges and victories na lang para Feno talaga siya ba?
Yes, so yes.
Feno ang
Raisa.
kasi sa Feno kasi you need to really be creative, no, sa mga words and mga descriptions natin.
Yes.
So pwede siya challenges and victories. Or rewards. Ma-rewards
And
ba?
then rewards.
Tingnan natin. Challenges and rewards. Challenges and rewards during the pandemic. Anak, ma'am. Okay.
Thank you po on that note.
Basta quali ma-challenge ito mga literaries.
Oo.
Actually, din ang naalala ko talaga na term ni Sir Portugaleza nga, Reyes. Kung pwede ba daw, actually gusto sana itanong the last time, ang term na talaga tinabi din is, pwede yung mga binayot na term? Pwede ba yung mga gano'n? Pero siguro ang ginamit niya doon is sabi nga ni Ma'am Reyes na we can play with the words, no? Parang gano'n siguro. Parang
Oo, kasi kailan very creative ka talaga in writing,
words.
especially sa Feno, kasi mga descriptions. Okay na
Siya
yung
dapat-
challenges and rewards.
Saka hindi siya dapat formal din, no? Dapat ano siya.
Pag-quali, ma'am, kay literary writing style, kay kung quanti-scientific, very scientific.
Oo, structure.
Wala ilang difference.
At saka whatever doon sa significant statements, importante yung formulated meaning mo talaga, ma'am. Dito sa formulated meaning, para hanay talaga yung sa clustering at saka sa teams, you can really extract, no, ng magaganda talaga ng mga descriptions doon. Actually, kaganda ng mga na-extract nila. Kulang na lang doon talaga sa team, no? How you will be describing it based doon sa mga significant statements.
Sige po, Lian. Thank you po.
Okay? So, Ma'am Reysa,
Yes, din.
doon na tayo sa proceed na tayo siguro sa chapter 4.
Apo din.
Ma'am Abe will take charge na yun dyan sa kanilang
Discussion na tayo
Chapter
na part.
unless may additional pa kayo sa chapter 3.
I think they have to revise the discussion as they revise also their themes din.
Yes,
Oo. Magdagdag na lang sila ng
Yes, ma'am.
adjective that was
whatever is being reflected in the findings, so should be reflected in the discussion. So if they the words that are being used no in chapter 3, like we are instead of disadvantage, advantages, for example, rewards and ano, so yun din yung gagamitin po nila. Consistent yan. So from table of contents, from abstract to table of contents, no? You need to double check yan lahat when we change something in your chapter 3. So pati sa table of contents nyo reflected yan, no? Yung mga different description ng mga themes. Okay. May na-observe ako sa kanilang running head. Nasa left side, it should be in the right side. Upper right, not on the upper left.
Ilipat ninyo.
Oo. Okay, Ma'am Reza, Ma'am Eroy, may additional pa kayo na recommendations? Students, do you have any clarification based on the recommendation of the panel?
sa recommendations, I just don't know, students, if may need pa ba kayo to, since you have included here the Department of Health, I just don't know, hindi ko kasi binasa lahat ng mga gathered na significant statements ninyo from your participants. I just don't know if kailangan nyo pa ba idagdag dyan sa recommendations ninyo ang government officials. Kung pwede nyo, kung meron ba kayong na-collect na statement pertaining to IATF policies. Majeda, meron ba kayong na-collect dyan? Meron kayong nakuhang
about IATF, ma'am.
Oo, they have talked about policies pertaining to COVID-19, IATF, local government units, yung mga ganyan.
Wala po, ma'am.
Wala.
Wala po.
Mamabe, is it academy pharmacist? What is the term being used sa mga pharmacists who are part of the academy? Academy pharmacist ang nalagay
academician.
niyo?
Wait lang. Yung nga, ano nga nakasulat sa kanila. May sinabi si Madge yan din eh. Bakit yun nga ang na-formulate mo, Madge?
Academy.
Oo.
Academy pala yun, ma'am. Academy pharmacist.
Academe dapat siguro, hindi academy.
Oo. Kaya gani.
Tinanong ko rin yan sa kanya. So, mas prefer
Kasi parang
academy,
academy.
pharmacy. Parang
Academy
school
lang.
kasi ang academies din, no? Parang physical structure. Chocolates, academy.
Kasi sa mga ano ninyo, like may community pharmacist, hospital pharmacist. Kaya giano niya na academy. Academy pharmacist. Can you look for other literatures, no, describing those pharmacists who are part of the academy?
Pharmacist in the academy at in the
Oo, pharmacist in the academy. Academy pharmacist kasi baka mag-iba na yung meaning pag sinabing academy pharmacist.
Okay, ang
Parang
academy
first time ko na-encounter. Oo.
place, parang place ng academy.
Pharmacist in the academy. Okay, so more, Ma'am Reza and Ma'am Eroy, so that we can proceed with the deliberation.
Okay na po, Kadin.
Okay. So, wala na rin siguro silang i-clarify. I know they have a very comprehensive manuscript, no? Okay, so